All right, Dr. Holt. So good morning. Tell us
Good
about
morning.
so tell us a little bit about you. So what do you do in your time?
I am a veterinary orthopedic surgeon, so I
So you
do
know a thing or two about bones, right?
just a few. And through weightlifting, I've destroyed my left shoulder joint to where it was bone on bone with significant osteoarthritis, and was on a pain level without meds, probably a 9 to a 10. And I feel like having both shoulders done, I had the same experience with both shoulders with Dr. Burns, that recovery was very short, pain-free. Incisions look fantastic. She closes them with an intradermal, which makes the incision almost go away when it heals. Um, okay, on the right shoulder, I had a conventional arthroplasty. On the left shoulder, I had a reverse arthroplasty. And when I went to rehab, the interesting thing, the first rehab on my right shoulder that they told me was, you are doing really well. Who was your surgeon? Was it Dr. Burns? And I said, yes. And they go, well, she tends to have the fastest recoveries because she's just very good, very careful with the anatomy, and very careful with her approaches and the way she does the procedures.
How many weeks out are you now on your left side, which had a reverse shoulder replacement?
I am 4 weeks and 4 days.
All right.
I came in, Dr. Catherine Burns shot some radiographs, said, that doesn't look good. So we went in for total shoulder arthroplasty. And post-operatively, my pain level never got above a 2. Fantastic recovery at home, did it outpatient. Everything went great. The medications worked fantastic. I was able to be very mobile after about 3 or 4 days. I wore my sling for the first 2 weeks and then gradually progressed out of that, although I wore the sling at night. And by 3.5, 4 weeks, I was back being able to do light surgeries and some mild orthopedics in my practice. And my range of motion has been fantastic and very minimal pain, if any.
All right. So show us how far you can lift up on your left side. Good. Okay. Come on back down. And then what about your right side? You're probably about a decade out, right? From
Yeah,
that
about
one?
8 years, yeah.
Okay. And that one you had an anatomic shoulder replacement.
Mm-hmm.
Okay. What would you tell patients who are thinking about shoulder replacement?
Sooner's better than later. Don't wait like I did. It'll get you out of pain very fast, and the return to function is very quick, much quicker than I originally thought it would be.